Should I be worried about re-injury when reaching physical therapy goals? Imagine crossing a finish line after months of hard work. You've met your physical therapy goals, but does that mean you're completely safe to jump back into your favorite sport? Not quite. While reaching your goals is a big step forward, it doesn't automatically mean your knee is ready for high-demand activities. Re-injury risk can still be present, especially if you return too soon or without proper preparation. After surgeries like anterior cruciate ligament reconstruction, the chance of re-injury remains a concern. Studies show that about 30% of people who go back to high-level sports within 2 years of surgery experience a second injury. This could be to the same knee or the opposite one. The risk doesn't disappear after the first year either. It can stay high for up to 5 years after your initial injury. So, completing physical therapy is progress, but it's not the finish line. Meeting your physical therapy goals means you've regained basic strength, flexibility, and movement. But these goals mainly focus on restoring fundamental functions. They don't always prepare you for the quick, intense movements needed in sports like basketball, soccer, or skiing. These activities involve cutting, pivoting, and jumping, which put extra stress on your knee. Younger athletes under 25 face higher re-injury rates, especially if they return to demanding sports too early. Nearly 1 in 4 athletes in this age group re-injure their reconstructed knee or injure the opposite knee after returning to sport. Timing is a key factor. Research shows that delaying your return to sports reduces the chance of re-injury. For each month you wait beyond 6 months after surgery, your re-injury risk drops by more than half. Waiting until at least 9 months after surgery is ideal. Even if you've hit your physical therapy goals at 6 months, waiting until 9 months or more can make a big difference. It's about giving your knee enough time to fully recover and adapt to the demands of sports. There are other factors that can increase your risk, even after you've finished therapy. Muscle imbalances are common. If your quadriceps muscles are not equally strong on both legs, your risk goes up. A difference of more than 2.5 centimeters in thigh circumference between legs is a warning sign. Movement mechanics also matter a lot. Poor landing techniques, improper cutting, and weak hip control can strain your knee, even if your basic strength looks good. These neuromuscular issues include excessive knee movement during cuts or jumps and poor posture. The type of sport you play influences your risk too. Sports involving lots of cutting, pivoting, or jumping, like basketball or skiing, carry a much higher chance of re-injury. If you're planning to return to these high-demand sports, it's wise to be extra cautious. Returning too early without proper assessment can lead to re-injury. If you go back before your physical therapist or surgeon clears you, your chances of getting hurt again increase significantly. Failing to meet sport-specific return-to-play criteria is another risk. Studies show that nearly 40% of athletes who don't pass these tests re-injure their knees, while only about 5% of those who do pass re-injure. This highlights the importance of not just meeting general physical therapy goals, but also passing specific tests designed to evaluate your readiness for sports. To reduce your chances of re-injury, work closely with your physical therapist on sport-specific exercises. These include jumping, landing, agility drills, and cutting movements. Make sure your movement mechanics are correct, especially your jumping and landing techniques. Proper form can prevent unnecessary strain on your knee. It's best to wait until at least 9 months after surgery before returning to high-risk sports. If you return earlier, your risk of injury is higher. Always get clearance from your healthcare team and pass return to sport testing before jumping back into competition. Reaching your physical therapy goals is a positive milestone, but it's not the final step. Your knee needs time to adapt to the demands of sports. Patience, proper assessment, and careful planning will help you avoid re-injury and keep your knee healthy for the long run.